So if you're an executive saying, get me more security guards, wrong answer. That's just wrong.
That is Shark Tank investor and businessman Kevin O'Leary bashing health insurance executives. In the wake of the assassination of UnitedHealth CEO Brian Thompson, many executives have refused to do anything but boost their own security.
Putting a fence around headquarters, hiring more security guards, that's all bad imagery, Wolf. It's all bad, and it's not the right answer. You got to read the room and realize right now that the public is turning against you. They are your customers, and they don't like it. Now, this poor man lost his life, horrific, but if anything good is going to come of this, it's going to be policy change, because you've basically got people lighting up their torches, just like in the Frankenstein story, and going to the castle, and they're going to burn it down.
Already in New York City, wanted posters have gone up with pictures of other health insurance executives.
They should be coming out now saying, look, we get it. We have families too. We're people. We have children. We care about what you think about, and we're going to automate this process and make it better, or do whatever they have to. That when you appeal a case, it's not a delay situation. And if you have a valid claim, you get paid out. That's what insurance is supposed to do. If you don't understand what you have to do now to get in front of this thing and say, look, it's on us. We hear you. We hear you. We hear you. And we're people too. We'll solve this problem. Here's how we're going to do it.
But at the moment, the for-profit healthcare insurance industry is not doing much introspection. Instead, industry executives and lobbyists are defending the practice of denying about 20% of all claims for procedures and treatment. UnitedHealth has one of the highest denial rates at about 33%.
Well, there's probably valid reasons to deny, but if it's set up so that you just can't appeal it in a way that is cost effective, because you can't afford to hire a lawyer, particularly in an expensive surgery, it doesn't matter. At this point, social media is now the jury, and it doesn't like what it sees. So if you're an executive, in interim management, UnitedHealthcare, or any other health company, you got to read the room, Wolf. You got to read the room.
A lot of people in corporate America have been shocked by the public understanding or empathy for alleged shooter Luigi Mangione. But keep in mind, as of today, there are more than 100 million Americans who are saddled with medical debt. And when you consider that 78% of Americans say they live paycheck to paycheck, well, it's understandable why so many people in the United States feel our healthcare system is literally bankrupting them. Also, most Americans pay about 40% of their income in taxes. But unlike other industrialized nations, you still have to pay more for health care. You have to pay more than what you already pay for the government. The United States is the only industrialized nation that does not have universal health care. The United States is the only industrialized nation where health care is treated as a privilege and not a right. A privilege if you can afford the private health care insurance. I want to say something very clear about the assassination of Brian Thompson. And there's been a lot that's been reported about what a wonderful guy he was, that he was a family man, that he was a pillar of his community in Minnesota, that he was a nice guy. All of those things can be true. And it's not unusual in the United States for nice people to be incentivized to work for companies that do bad things. There are a lot of nice people who worked in the tobacco industry. There are a lot of nice people, upstanding citizens who worked in the firearm industry. But for some reason in the United States, we have given this perverse incentive to make money off of people's misery. And so a lot of us might say, hey, if somebody paid me $10 million, sure. $10 million a year, sure. I'll go be the CEO of a healthcare insurance company, and I would still be a good person, and I would try to do my best at that job. But there's something about our system that is wrong when we incentivize companies to make money, to profit off of people's misery and healthcare. And when there's an incentive for health insurance companies to deny coverage in order to pad profits and the stocks of those healthcare corporations. That's wrong. So how do we fix all of this? Well, first of all, I think we recognize, as many people are, that yes, assassinations, murder is wrong. It's wrong whether it's a healthcare executive. It's wrong for people who say that Luigi Mangione should be assassinated in prison. Murder is wrong. We cannot have a justice system where people take justice into their own hands. Vigilante justice undermines what the United States stands for. And we can also appreciate that there are a lot of decent, good people who work in these healthcare positions who deserve to be able to live out their lives. But what we need to do is find some way to take good people and direct them or give them an incentive so that they work for the greater good as opposed to working for a company's profits. The for-profit healthcare system in the United States is perverse. It breaks us. It breaks our society. And most Americans now realize that. There have been a number of polls that have been taken over the last several years that have found 65% of Americans support Medicare for all, a universal health care system that Bernie Sanders and others have proposed. And there's a majority of Republicans who also support Medicare for all. So this isn't a huge political risk to move in this direction and go away from the for-profit healthcare system. And by the way, there are some elements of U.S. society that already do not have a for-profit motive in their healthcare. One of them involves the U.S. military. If you're a member of the U.S. military, you have access to what's known as the TRICARE health system. It's not a for-profit healthcare system. It's a system that provides care for every member of the military to make sure they get what they need for their treatment, for their medication, whatever it is. They love the TRICARE system. Approval ratings for the TRICARE health system are terrific. So if we can do that for our military, and we've got 1.4 million active duty military members, why is it that we cannot do that for other parts of our society? And we also have Medicare for all, as I mentioned, so a lot of seniors have essentially a form of universal coverage that's provided by the government. So what's the answer? In my view, the answer is to do something like what some of our industrialized allies are doing, particularly, for example, the nation of France. In France, there is a basic level of universal health care that is provided. But if you want to get treated with caviar in your healthcare stays and all sorts of extras, you can pay more. You can add private coverage to your basic foundation of insurance. It's sort of the best of both worlds. Everybody gets a minimum level of coverage, so everybody gets health insurance. Everybody gets treatment for emergencies, for when they get sick, for whatever may be ailing them. But if you want the experimental therapies, if you want the super expensive surgeries that may or may not work, well, you pay a little bit extra to the private insurance company to make sure that you get that when you need it. It's a sort of hybrid system, and in France, the French love it. A lot of people in the UK love their sort of hybrid system. There are similar systems in Australia and Italy. A lot of countries where if you go and you get sick, you just go to the doctor and they take care of you. In the United States, if you get sick, you may be out of luck financially. Maybe you lose your home or you lose where you live or you realize, oh, now I'm going to have to go into debt. And by the way, we're doing something very perverse here in the United States because we're enabling other people to profit off of our misery. That's wrong. Most Americans recognize that. And even Shark Tank's Kevin O'Leary understands that the health insurance companies have to do better. They have to cover more people. They have to show that they're not as greedy as the perception stands right now, because there is an incredible amount of anger that is just bubbling up and seething out there in the United States, and for good reason, because our healthcare system, it brings out the worst in American capitalism, and it treats us the worst in terms of the misery index that so many of us have if we have to go see a doctor, because we're left wondering, am I going to be able to afford this? We can do better. I'm David Shuster. Thanks for watching.